And she's going to talk at you for a minute. Thank you, Tammy, for being here.
Yay, Tammy!
I don't know if this is good or bad that I can't see your face.
Probably better.
Well, I want to thank you all for coming because this is a huge purpose for many people in this room directly, but so many people that you absolutely have never heard of shaken baby syndrome. I had a benefit for my son probably 3.5 years ago for the first time. And mostly I wanted it to be an awareness event. I wanted people to learn about it. We don't want anyone else to go through our challenges, all of the things that we have to go through. And so we need to let people know about what it is that causes this. And so many people said, I didn't even know this existed. I'd never heard of this before. And so I already know that I've reached out to so many people and let them know, and they tell their friends. So please just know that this is what this is all about. This is to make sure you make sure to let all your friends know it is real, and is in 1 second you can change the life of a child. And this is my son Chase.
Hi, Chase.
So since
Yeah.
kind of cool that we follow this band called Chasing Oz. So Chase's story, he's now just turned 20 years old on Thursday.
Woo! Yeah! Happy birthday!
Happy birthday, Chase.
Yeah.
And Chase was actually born with a genetic disease that gave him no immune system. So he already was facing challenges in life from the get-go. It was something that we could manage. It would be fine. But at 5 weeks old, he was shaken by his father, his biological father, and he broke both of his legs. And at the time, it wasn't visible from the outside. As with shaken baby syndrome, 95% of the time you never know until hours later. In our case, it was approximately 18 hours later. And the blood tends to seep onto the brain and causes seizures, and those types of things are the signs. And Chase's signs happened in the evening, and so he was raced to the hospital, where then we ultimately found out he had 2 broken legs that were internal, so you couldn't see those either. And Chase had a long road to recovery. He endured physical therapy, speech therapy, 4 times a week, just to become normal, average, on seizure medication. You've got a child who's being sedated and on medication for his first year of life. It's not what any child should ever have to do, or a family should have to go through. And he has a sister that's a year older. So these were some serious challenges that a child ends up and a family goes through as a result of shaken baby syndrome. Now, he got better, but as you can see, about 6 years ago, Chase started having further challenges, started limping, and progressed to further speaking problems and coordination problems. And we're trying to figure out if there's any process or any prognosis to help him, but currently we try to do everything we can to make Chase happy. And he used to have a fun life playing baseball, and as a matter of fact, one of his old baseball teammates is here tonight, coincidentally, from junior high. So you never know what can happen with shaken baby syndrome. The brain is so unique to every one of us. A brain injury is so unique to every single person. You can't say that, oh, it wasn't that bad. You can't say that, oh, you know, I didn't really do that much. It is damage, and it can come and have sounding effects years later, as we've seen. So I again really want to thank all of you who are here, and we are in turn going to have one of our own fun events. If anyone's interested, on June 6th at Destination Harley, we're going to have a fun run, and it will be something to benefit for Chase. We're trying to raise money for a wheelchair van, which if anyone's ever shopped for one, they're very expensive. We're looking at $40,000. So this is what we're all about. Shannon and I have met a few years back, and unfortunately, Shaken Baby Syndrome Network is not a fun place to meet people, but you do meet people who help you get through the rough times and help you learn about the challenges of what other people are going through, and we're all here to support one another. So hopefully, you know, if you all want to have any part of it, keep watching on Facebook. So by next week, we'll have a lot more information for another fun event. And don't forget to go out and bid on some of those items at the auction, the silent auction tables, so we can help this event. Thank you.